Good morning, Dr. Goodwin. Hello.
Good morning.
Good morning. More than 75% of women eligible for breast reconstruction are not told about all of their options. October is Breast Cancer Awareness Month, and the American Society of Plastic Surgeons believes that all women should be fully informed about their rights and options when it comes to reconstructive surgery. Former president of the American Society of Plastic Surgeons, Dr. David Song, also an academic chair of plastic surgery at Georgetown University Medical Center, and breast reconstruction patient Carin Silkaitis, a Chicago actor and director, are here to educate our Health Power viewers on women's options for breast reconstruction. So hello to both of you.
Hello.
Hi.
Carin,
Yeah.
as someone who has undergone breast reconstruction, tell us about your personal journey from diagnosis to reconstruction and your return to a confident, healthy lifestyle in the performing arts.
Yes, great, thank you. So I was diagnosed with the BRCA1, the BRCA gene, and I worked with a team of medical professionals, including a board-certified plastic surgeon, to make the best decisions for me. We did opt to go with bilateral mastectomies, followed by reconstruction. And on my own journey, I feel like this medical team of professionals really helped me make the best decision for my very busy life as a performer, as a mom, and get me back to my life feeling confident, feeling attractive, feeling empowered.
One point, when you mentioned the BRCA or BRCA gene,
Yes.
we should tell our audience that if one has that gene, it increases one's chances of developing breast cancer.
Yeah, significantly. I was given statistics, including my family history, of over 90%. And once I did start developing signs of breast cancer, that's when I elected to have the surgery.
Okay, go on. Did you have both breasts removed?
I did, yes.
All right, go right ahead.
So I feel like the team of doctors that surrounded me, including my plastic surgeon, who was involved from the beginning, helped me make the best decision for me and really turned a negative into a positive, in that I feel healthy and I feel empowered, that I was able to be informed and make my own decisions.
Okay, and Dr. Sellon, why do so many women feel misinformed about their options regarding breast reconstructive surgery?
Well, I think when a woman's diagnosed with breast cancer, there's a lot of confusion that goes on in her mind, and we at the American Society of Plastic Surgeons want to make sure that all women are well informed of their choices, from implants to using your own abdominal tissue or to a combination of both. To that end, the American Society of Plastic Surgeons spearheaded the passage of the Breast Cancer Patient Education Act, which mandates everyone to be informed about their options for breast reconstruction.
Okay. And how does one get more information about the Breast Reconstruction Education Act?
Well, first they should ask their care provider, but they can also go to breastreconusa.org, where they'll
Okay, let's go more slowly so we're sure people get that
Sure.
web address.
Sure, it's breastreconusa.org.
Okay.
And there, patients can find testimonials, how a breast recon will look and feel, and be armed with information to then go back to their care team to have that critical discussion.
Okay. And Carin, what
Yes.
are some obstacles women face when making a decision about whether or not to undergo breast reconstructive surgery, and what are the positive effects that survivors have?
Sure, yeah. I think that I think a lot of obstacles stem from both being overwhelmed with the diagnosis, followed by maybe a lack of information. I feel very lucky that my care team, including my board certified plastic surgeon, were able to present me with a number of options so that I felt like I had a choice, right, in my care. So I think that if women can go to websites like Dr. Song just mentioned and look at patient testimonials and be able to look at before and after pictures so you know what your body's going to look like and feel like after your reconstruction, I think that's really helpful.
Okay, and Dr. Song, should the team that's involved in the decision making include a plastic surgeon from the beginning, and why?
Thank you for asking that. I think it's critical for a plastic surgeon to be involved at step one so that we can plan and coordinate the care and tailor it to every individual patient. There's a lot of choices and a lot of options. We want to make sure that patients are armed and informed with all their options so they can make a decision that's right for them.
Okay, and what's the specific role of the plastic surgeon?
Well, we help to plan the incision. We help to plan the timing of radiation, perhaps, when a patient decides to choose reconstruction, immediate or delayed. So these important issues are discussed up front, and the care team can then plan for it as opposed to trying to react to it.
Okay, all right. And at what point does the patient and the team decide which way to go?
Well, I think that's very individually based, but we feel that it's important that patients get that information up front so that they can plan and know their options and have that discussion with the care team.
Okay. And I assume you use, what do I want to say, examples that you can show patients of what things will look like?
Absolutely. And once again, when your viewers and your audience goes to breastreconusa.org, they'll have a plethora of information as well as before and after pictures of what reconstruction can look and feel like.
I was going to say, not just look like, but also how it feels.
That's right.
Okay, that's very good to know. And Carin, what else would you want to say in terms of how women feel after they've had reconstructive surgery?
Sure, yeah. For me, I know it's probably personal for every woman, but for me, it allowed me to feel very empowered again, be able to get back to my life feeling whole. And I think that after post-surgery, I feel like that's one of the most important things, is feeling like yourself again, feeling whole, feeling confident. And for me, that's definitely what the reconstruction did for me.
Okay, and so you're very pleased with the decision you made?
Oh, absolutely. My plastic surgeon was excellent. And I feel like I not only got all the information that I needed, but I feel like the information presented to me that enabled me to come up with my choice that was best for my body. It really worked out very well, and all of it was very accurate. The way that the surgery turned out was exactly how they said it was going to be, and I feel great.
Okay, and you're back active in the performing arts?
I am, yes, both performing and directing.
Right, okay. Dr. Song, I want to thank you and Carin for sharing this information with my Health Power audience. I'm sure it has been very helpful for them. And with this being Breast Cancer Awareness Month, it's very important that we're sharing this information at this time.
Absolutely.
Thank you.
Okay, have a good day, both.
You too. Thank you for having us.